There is a 4 category because
Okay.
generally people get confused where I have to approach. There is a psychiatrist, clinical psychologist, or some people say counseling psychologist,
Okay.
and counselor, clinical psychologists who handle that kind of severe cases.
Okay.
And they have authority to do the diagnosis of assessment. In India, when we say, in India, most of the time, people go to the psychiatrist easily. There is so many things because people get confused on that. When you know, boss, at least from a more than 3 weeks,
Okay.
like suppose you have a fever,
Yes.
or you have a certain things, and doctor say, okay, normal viral fever is there, or
Yeah,
normal
right.
fever is there. So then they decide after 4 days only,
Yes.
or certain test,
Yes,
because
right.
immediately they cannot. 1 or 2 days they have to check.
Yes, right. Hi guys, we have Mitesh Thakkar here, who is owner and founder of MBS Holistic Clinic, and he has 19 plus years experience in psychologist and hypnotherapist, and he has 22 years plus experience in pranic healing, Reiki and yoga therapist, and also he has 17 years plus amazing experience in corporate workshops and training, and he has served in corporate sectors like Indian Air Force, ISRO, BSF, Bank of Baroda, Tata Alexis, Tata Coffee, HPCL, HP, Rolls-Royce, ABB and many more. So let's talk to him. Yeah, hi Mitesh.
Hi.
Yeah, I just want to ask some of the questions like the difference between psychologist and psychiatrist.
There is a 4 category because
Okay.
generally people get confused where I have to approach. There is a psychiatrist, clinical psychologist, or some people say counseling psychologist,
Okay.
and counselor.
Okay.
There is 4 different things. First, psychiatrist. Psychiatrist prescribe you the medication.
Okay.
Okay, they are do MBBS, MD, and specialized in mental health. So that's why they are category come called psychiatrist. If you want to go for the medication, okay, or severe problem, then medications where certain times medications require for the mental health. So there you have to approach the psychiatrist.
Okay.
Assessment and diagnosis, like suppose you do the blood test, or for example you have to do MRI, CT scan. So therefore MRI, CT scan, radiologist is there. For blood test, pathologist is there. In that same manner, the severe disease, like severity in psychiatrist disorder, like suppose people have a schizophrenia, people have a certain severe depressions, severe where require medical help in a form of sometimes we have to admit the patient. That kind of severity, little lower than that severity, it is called a clinical psychologist who handle that kind of severe cases.
Okay.
And they have authority to do the diagnosis of assessment.
Okay.
So who are the licensed RCI licensed psychologist, clinical psychologist? For them require a qualification of MPhil or PhD. Now there is a sometimes category change. Previously required the MPhil. Now they say कि PhD also include on that. So sometimes RCI rules change. So based on that differs come.
Okay.
So that is the one part. Then come clinical psychologist. Afterwards come counseling psychologist or psychologist.
Okay.
Okay. In that they can able to do therapy. They don't have authority to do a diagnosis or assessment tools.
Okay.
They have even certain courses they do, which is registered with the RCI and all. That category people can do the assessment. Otherwise, generally, if you see the legalese and RCI rules, it is not. They are not authorized to do assessments. They do only a therapy where medications also going not too severe, but little that we have a medication plus counselings and therapy they can do in a different therapy. Who are expert psychologists are expert in a different therapy.
Okay.
Such like behavior therapy, cognitive behavior therapy, psychoanalysis, psychotherapy,
Okay.
transaction analysis. So many therapies are there in the psychology. If
Okay.
you go details, you find out multiple therapies are there. So they have a expertise. Even clinical psychology has also expertise on certain therapy which is their good qualities on that part. Okay. And then come counselor. So who are not on medication, that they can approach the counselor, even psychologists also do who are not on medications and everything, then they can approach the counselor also. So these the 4 different categories are there and different approach are there.
So can you please let me know who will decide client has to go with the psychologist or psychiatrist or counselor? Who will decide? Now, how can we decide for that individual client also?
Because there is so many things, because people get confused on that. When you know, okay, boss, at least from a more than a 3 weeks,
Okay.
like suppose you have a fever
Yes.
or you have a certain thing, so then doctor say, okay, normal viral fever is there or
Yeah,
normal fever is there. So you know, okay, then they decide after 4 days only
Yes.
or certain test,
Yes.
because
right.
immediately they cannot, 1 or 2 days they have to check,
Yes. Right.
right?
Right.
In a same manner, when you are going through with the certain any mental health, emotional problem or any trauma or any incidents happen or office or any reason, financial pressure, so many have a different reason to go through the mental health and emotional issues.
Yes.
So in that you have to check the severity.
Okay.
Like suppose you are not able to get sleep or you are so much getting hyper, people are so aggressive, they are breaking things. So in frequency is more, like suppose breaking things, but like once in a 6 months, sometimes people get angry and break things is a different part,
Okay.
not regular anger issues. Once in a while, anger, any normal people can get it. But in a frequencies are more,
Okay.
then you have to check, okay, you have to approach a psychiatrist, because some people say, no, I don't believe on counseling or talk
Yeah.
or therapy and all. So they go for the medication. Some people say, no, I don't want to go for the medication, because they are aware of what is the impact of medication and certain things. So sometimes people are not, they don't like medication. So they go to the psychologist. But in that also, psychologists also recommend.
Yes.
So when the severity they find out, clinical psychologists and psychologists, and sometimes counselor can do that job, depend on their experience.
Okay.
But I say psychologist and clinical psychologist, they understand, because they know, okay, what is the severity and all. Within 1 or 2 sessions they come to know. Sometimes within first session also they come to know. So they recommend you can go to the psychiatrist. So medications also require, and simultaneously therapy also require.
So you can say that both the vice versa, they can recommend each other.
Yes,
Yeah.
definitely.
So client can take both the things together and they can improve themselves.
Yeah.
Very fast.
But in India, when we say, okay, in India, most of the time, people go to the psychiatrist easily and then
Okay.
go to the psychologist.
Okay.
Some people who know mental
Yes.
health and they have awareness, they directly approach to the psychologist. But what's my knowledge in Western and out of US, Canada, other countries, there people first go to the psychologist and they decide that they require medication or not.
Okay. Yes.
Like I just few minutes before I told you, okay, clinical psychologist and psychologist clinical psychologist has the authority to diagnosis.
Yes. Right.
Like pathologist and radiologist.
Okay.
So in that manner.